Welcome back guys. Now let's discuss about the law of projection. So what exactly is law of projection? I have already told you. When we stimulate at a receptor, let's say I'm stimulating here. So receptor is going to be activated. See, I'm giving the stimulus at the skin. Okay, I'm stimulating here. See, the receptor is activated. Receptor will give the information to the first order neurons. First order neurons will give the information to second and third, and ultimately the somatosensory cortex is going to be activated. Okay, but tell me where I am exactly feeling the sensation. I am exactly feeling the sensation with somatosensory cortex because the information, the sensory information with the help of first order, second order and third order neurons, the information has gone to the somatosensory cortex. So I am actually feeling the sensation in the somatosensory cortex, but the cortex will make me believe the sensation I am feeling it in the skin region. I am not exactly feeling in the skin region, I am actually feeling it in the somatosensory cortex. Okay, let me give you a better example. With this example you will get the clarity. Look at here. Imagine this is, here is my foot and here is the spinal cord, thalamus, and here is the somatosensory cortex, let's say. Okay, here is a cortex. Now whenever someone is coming and touching your foot, okay, someone comes and touches your foot. So who is going to be activated? Receptor is going to be activated. Now from the receptor, the information will be taken by this first order neuron. The first order neuron will give the information to the second order neuron. Second order neuron will cross to the opposite side, and second order neurons will take the information to thalamus. And from the thalamus, the third order neurons will take the information to somatosensory cortex. So this is the area where you are going to feel the sensations in the foot region. Okay, so this is the area where you exactly feel the sensations from the foot region. So this is a normal sensory pathway, like including the receptor, first order neuron, second order neuron, third order, foot, somatosensory cortex region. Okay, now you gave the stimulus at the foot. Okay, this is the area where you are giving the stimulus, but actually where you felt the sensation, you felt the sensation in the somatosensory cortex. But cortex will make you believe, the cortex is going to project these sensations to the location of the receptor. The cortex will make you believe that you are feeling the sensation in the skin region, in this region, but actually where you are feeling it in, you are feeling it in the cortex. Okay, for example, today I am stimulating this second order neuron. I am not touching your foot, I am not touching anything. I am directly stimulating the second order neuron, let's say. The second order neuron is going to activate the third order neuron. Third order neuron is going to activate the somatosensory cortex foot area. So again your foot area is activated. So you will automatically feel the sensation from the foot region. No one is touching your foot, but you will feel the sensation from the foot region. Or directly I am opening your cranial bones. Okay, I am opening your cranium, and with an electrode I am directly stimulating this foot area. Okay, I am directly stimulating the foot area. So tell me, whenever this foot area is activated, where you will start to feel the sensation? You will start to feel as if someone is touching your foot, but no one is touching your foot. So cortex is making you believe, okay, so that you are feeling the sensation in the foot region, but actually where you are feeling it? You are feeling it in the somatosensory cortex, foot area you are feeling it. Okay, so this is called as the law of projection. The cortex is going to project, it will make you believe, okay, the sensation is coming from the location of receptors, the sensation is felt at the location of receptors. This is called as a law of projection. Now let me tell you why you should know this law of projection as a doctor. Let's say in this patient, okay, this is our patient, and what happened to this patient? This patient is having a road traffic accident, let's say. Now during this road traffic accident, his right leg, okay, the right lower limb, the total right lower limb is crushed during the accident. It's totally crushed and you can't do anything about it, and you have performed the amputation. Okay, now you have removed his leg, foot, everything is removed. So now let me show you that here he lost his lower limb. Okay, this right lower limb is gone. Now luckily he survived. Okay, you send him back to home. So he is going to come after 1 month. Now 1 month passed. 1 month. So after 1 month we are talking, what is the situation? After 1 month he is going to show up to the clinic, and you are asking him, is everything okay? You are getting the details. Is everything okay? Are you feeling any abnormal sensations? You are asking. So now the patient is going to say, sir, everything okay, but I am having this one issue. What is that? He is having pain sensation or some itching sensation from the right foot. Now you are looking at the foot, the right limb itself is not there. The total right limb was amputated. He is not having the right foot, but he can still feel the sensation from the right foot. So tell me, is it really possible he is not having the foot? Is it really possible, or is it just psychological? It's really possible. He is really feeling the sensation from the right foot. Sir, how is it possible? Because the foot is not there, no? How can he feel the pain sensation from the foot? Maybe foot is gone, but foot area is still present. Foot area is still present. If this foot area, if it is activated, you tell me, because of some reason, if the foot area is activated, what will happen? Now he will start to feel the sensation from the foot region. Now he will believe that the sensation is coming from the foot region, but foot is not there. So that is what law of projection is telling us. Law of projection will tell you the sensations are not felt in the foot but in the foot area. If this foot area is activated, see, if the foot area is activated, you will automatically feel the sensation from the foot. If the genital area is activated, you will automatically feel the sensation coming from the genitalia. Okay, if the face region is activated, you will automatically feel someone is touching your face. So sensations are not felt in at the level of the skin, they are actually felt in the somatosensory cortex. Okay, so this is called as a phantom limb phenomena. Phantom limb. So what is phantom limb phenomena? Phantom limb phenomena means a person who is not having a limb, who lost his limb, he can still feel the sensation. He can still feel the sensation in the limb that is absent. How is it possible? This is explained by law of projection. Law of projection will tell you the cortex is projecting, okay, the sensations to the location of the receptors. Okay, so now you understand what is phantom limb phenomena. Let me explain you. Sir, first of all, why the foot area is getting activated? Okay, in this person, if the foot area is activated, he will start to feel the sensation coming from the foot region. But first of all, why the foot area is getting activated, sir? Why is it getting activated? He lost his limb. No, he lost his limb. There is no more foot. So this area is not getting any stimulus. If this area is activated, he will start to feel the sensation from the foot. But why this foot area is getting activated in the first place? The reason is, let me tell you. See, imagine you are having a friend. Okay, imagine you are having a friend and this friend is having a breakup. He is a very good guy. He is having a breakup. So tell me, after having a breakup, how he is going to feel? He will be excited? No, sir, he is not excited. He is not like you. He is dull now, he is depressed, he is not eating anything, he is not attending the classes, he is totally depressed. Okay, he is sleeping, he is depressed. So now when he is depressed, as a good friend, what you are going to do? You are going to motivate him. You are going to say, don't worry, okay, she lost you, you are a gem. Okay, she is the one who is having the fault. They will try to motivate you with good words, they will try to motivate you. They are going to say a lot of options are available in the future, you can get a good girl. So they will try to motivate you. In the same way, whenever this area is depressed, see, whenever the foot is gone, this area is not receiving any information, it's not receiving any signals. So this area went into depression, let's say, this area went into depression, it's not receiving any signals. So the surrounding parts of the cortex, okay, the surrounding parts of the cortex will start to stimulate this area. Okay, the surrounding parts of the cortex will start to stimulate this area. Actually, what exactly happens is the surrounding parts of the cortex will start to share their work to this region. Or you are simply sitting idle, you are not doing any work. Okay, you are not doing any work. Okay, try to share our work. So the surrounding parts of the brain, they will start to project these neurons, these new connections. They will start to stimulate this area. They're sharing their work. So during this process, tell me which area is getting activated? Is the foot area getting activated? Now tell me when the foot area is getting activated. Okay, when the foot area is getting activated, so he will automatically start to feel the sensation coming from the foot region. Now you understand? So what is happening? Whenever this area is not receiving any signal, it's not receiving any signals, so that area is depressed. So the surrounding parts of the brain will start to share their work, starting to activate this region. So the foot area is activated, so he will start to feel the sensation coming from the foot. So this is called as cortical plasticity. Cortical plasticity. Plasticity means plastic. The exact word of the meaning of the word plastic means changing. You can change it. Means what is happening? See, the function of this area is changing now. Actually, it was supposed to receive the sensation from the foot, but now it is changing. It is receiving the sensation from the different parts of the somatosensory cortex. After few days, do you know what will happen? This entire area will get a new work. Totally, it's going to be allotted a new work. Okay, so the area which was supposed to get the sensation from the foot, now it is receiving the sensation from the surrounding parts of the brain. So during this process, in the initial days, in the initial 1-2 months, what happens is he will start to feel the sensation from the foot. So this is called as phantom limb phenomena. Okay. So now tell me, what exactly is phantom limb phenomena? Phantom limb phenomena, the patient with an amputated limb may complain, he is going to complain pain or some other sensation in the limb that is absent. This is due to law of projection, or you can say cortical plasticity. Okay, I have told you what is cortical plasticity. Cortical plasticity means the surrounding parts of the brain, surrounding parts of the somatosensory cortex will start to stimulate this region. That is called as a cortical plasticity. Now, you look at the definition of law of projection. Law of projection will tell you if you stimulate sensory pathway, that is along its course, that's first order, second order, third order neuron, somatosensory cortex. If you stimulate the sensory pathway along its course to the somatosensory cortex, if you stimulate anywhere, you either stimulate the first order neuron, second order neuron, third order neuron, or directly somatosensory cortex, you stimulate anywhere, the conscious sensation produced, he will consciously, he will perceive, okay, the conscious sensation produced is perceived to be from the location of the receptors. He will start to feel as if the sensation is coming from the skin region, or he will start to feel the sensation in the skin region or the receptor region. So this principle is called as law of projection. You directly stimulate the somatosensory cortex. For example, look at here. You directly stimulate this part of the somatosensory cortex. He will start to feel the sensation coming from the foot region, the genital region, but no one is touching his genitals. Okay, so this is what the projection means. The cortex is going to project the sensation to the location of the receptors. We will start to believe that you are actually feeling the sensation here, but no, you are not feeling the sensation here. You are actually feeling it in the somatosensory cortex. Okay, so that is law of projection and phantom limb phenomena. Okay, so one MCQ they will ask in your exam, that is phantom limb phenomena is explained by law of projection. If that's not there, you can also answer cortical plasticity. With this, we have completed the topic. Hope the video is helpful. Thank you.